In this video, we will be measuring blood pressure. For this assessment, you will need a blood pressure cuff and a stethoscope. The room should be quiet in order to hear through the stethoscope. Patients should be seated quietly for at least 5 minutes in a chair with their feet on the floor, their back supported, and their arms supported at heart level with palms facing up. Patients should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes before the measurement. Before measuring blood pressure, make sure to locate the brachial artery on the patient's arm. The appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Many adults require a large adult cuff. Make sure to wrap the cuff firmly around the upper arm at heart level and align the cuff with the brachial artery. The stethoscope's prongs should face outwards. Tap the stethoscope to make sure it's working. Place the stethoscope chest piece below the antecubital space over the brachial artery. The bell and diaphragm side of the chest piece appear equally effective in assessing. Quickly begin to inflate the cuff pressure up to 200 millimeters of mercury above the first Chordkraft sound. Once inflated, slowly start to release the pressure at rates equal to 2 to 5 millimeters of mercury. Systolic blood pressure is the point at which the first of 2 or more Chordkraft sounds are heard in phase 1, and the diastolic blood pressure is the point before the disappearance of the Chordkraft sounds in phase 5. At least 2 measurements should be made. Before measuring again, there should be a minimum of 1 minute apart, and the average should be taken. This chart shows the classification of blood pressure for adults.